Now, dear friends, there is another aspect of adult cardiothoracic surgery that I would like to mention here. That apart from bypass, what we also tend to tackle are problems related to the valves that are inside the heart. Now, these valves with age or due to a certain disease called rheumatic heart disease can also get affected and become very small and become very hard. That means they do not open and close well, causing a lot of problems to the patient, mainly breathlessness, or they accumulate fluid in the lungs and they can't lie down or do anything. Now, these valves are tackled by removing them or repairing them. Repairing can be done in a small subset of patients, but most of the rheumatic heart disease patients have to have their valves replaced. Valves are replaced by artificial valves, which are available in two types. One is mechanical valves, that is made from a steel-like substance called pyrrolite carbon, which is very lightweight but very strong. And the other is a tissue valve, which is made from either pig's heart valves or from the covering of the heart from a cow, which are also called bovine pericardium. Now, the differences between the two are the mechanical valves are more commonly used in younger patients as they last longer and are very durable. The downside is the patient will have to take a blood thinner, very strong blood thinner lifelong, so that blood will not clot when it touches the valve. The tissue valve does not have this disadvantage. The patient will only have to be taken on aspirin lifelong and not have to have the blood tested again, time and again. The other variety of valves is the tissue valves, which are made from a pig heart valve or from the covering of the heart from a cow called bovine pericardium. Now, these valves have the advantage of not needing a very strong blood thinner, so that patient can remain only on aspirin lifelong. The downside is that these valves can get destroyed much faster, and in the younger patients that last hardly 5 years. The bovine pericardium valves do tend to last longer, but in the end they can also undergo degeneration and have to have a second operation. So, we tend to put these valves in older patients, that is 65 plus. The operation that we do for these valve replacement is in a sense an open heart operation. That means the patient is connected to the heart-lung machine. We'll have the heart stopped by injecting a solution called cardioplagia into the coronary arteries, which will arrest the heart in diastole. And after that, the heart is opened in the proper chamber and the affected valve is removed, cut out, and the new valve is stitched in place. The new valve is then located down and the heart is closed and then restarted, so that once the heart starts beating on its own, the patient can be taken off the heart-lung machine. Now, this technique has been around for a long time and has now become very safe. Once the patient is fully doing everything on his own as far as the heart goes and the lungs go, then the blood thinner that we give is reversed and then the chest is closed in layers. The sternum, which is the breastbone, is brought together using steel wire, and the remaining layers with the absorbable suture material. It's usually vicryl, and the skin is sutured with the monocryl, with a subcuticular layer, so that there are no stitches to be removed. We do tend to leave 2 or 3 drains behind in the chest, so that any fluid that collects there will be drained out in the post-operative period and not cause any compression on the heart. Once the drains are removed, the patient is then shifted to the room or the ward outside the ICU. Therefore, to conclude my little talk, bypass surgery or valve replacement surgery has become pretty safe and has stood the test of time, and therefore a lot of patients are getting benefit and going back to productive and normal lifestyles after this treatment. The whole treatment will last about 5 to 7 days in the hospital, and essentially means that patients are no longer bed bound after this treatment and are encouraged to walk about and go back to as near normal as possible, probably over the period of 3 months. Initially, we advise patients not to lift weights for up to 3 months or do any activity that will cause movement of the arms, such as cycling, swimming, lifting baggage or chairs, etc. Even riding two-wheelers is prohibited for at least 6 months, as that can cause a lot of pain to the chest wound. Four-wheeler driving can be started after 6 weeks, but initially it has to be for short distances only. Once the patient crosses the 3-month mark, then the distances that they go can be gradually increased. So also the physical activity, that has also got to be done in a graded fashion, so that gradual increase will not cause any harm or undue pain to the patient.